Okay, so let's talk with Hamad again. So Hamad is a postdoctoral research associate in the InToxFIRE project in the Firefighters Center at Ulster University. So Hamad is a senior analytical chemist and a material scientist with education in polymer engineering and environmental science. Okay, the floor is yours, Hamad.
Thank you very much, Jonathan, for a nice introduction. And hello again, it is me. And I'm going to, in this presentation, I'm going to share you some of the results we've got with a survey on limitations of decontamination procedures for firefighters PPE. Next slide, please. Yeah. Like the objectives of this study is a part of InToxFIRE study, and the objectives of this study was to evaluate the effectiveness and limitations of current decontamination procedures for firefighters PPE from their own perspective. Also we would like to gather insights on limitations and challenges in implementation of new decontamination procedures, and also then using those we would like to propose evidence-based recommendations for enhancing or changing decontamination procedures, and finally to determine whether further research is required and what training materials should be developed. So as I mentioned, this study is a part of InToxFIRE project, and this is the obtained result of an ongoing study as a part of the InToxFIRE project. This part of the assessments was carried out by Sean Dobbin under supervision of Dr. Svetlana Tretyakova-McNally. Next slide, please. Yeah, the methodology we use to gather and to collect all the data for this study was in two major ways. The first one was questionnaire, and an online survey that could be sent to any active or retired firefighter was prepared, and then questions were designed in a way to cover the firefighters' experience and their adherence to decontamination procedures, and the challenges and recommendations on their perspective. And also the survey was sent to fire stations in the UK, Ireland, Australia, and the United States at this level. And then in the second line, it was semi-structured interviews, which was getting insights from experienced firefighters, and interviewees were from different countries. And the semi-structured approach of the interview helped us to keep the discussion all on the context and allowed for flexibility in asking follow-up questions. Also, 3 people are interviewed so far, and in this presentation, the results are based on interview with those interviewees and the collected questionnaires. Next slide, please. Yeah. And as I mentioned, 3 interviewees were there. The first one was from United Kingdom, which with 14 years experience in this in fire service as a private industrial firefighter or senior manager. The second one was from Ireland with 20 years experience in fire service as a firefighter, station officer, assistant chief fire officer, and the third one was from United States with 11 years in fire service as a volunteer firefighter, lieutenant, captain, and assistant chief fire officer. Next slide, please. Yeah, and also the questionnaire, we wanted to first to collect some information, then alter the rest of the study and get the as good as possible results, as related as possible. So what we did, first we distributed the questionnaire among 100 firefighters worldwide, and then we collected their information. And you can see 66% were from United Kingdom, and then 15% from Australia, and 9% from United States, and 9% from Ireland, and 1% from Italy. The next slide, please. And then we started the analyze participants like background first to see how we can implement like their perspectives and the results on the continue of this study. And you can see like 58% of the respondents have been active as a firefighter for more than 10 years. And also, other than this, the 18% were in this part, like from 5 to 10 years, and then 16% from 2 to 5 years. And also 8% of the respondents said, like stated that they attend incidents daily, and 45% of them said they attend to incidents every week. And then the rest of them, like about 35%, attend like once per month, and then followed by 10% and bi-monthly, and then 5% as a rarely. Next slide, please. Yeah, this did, I think from this part, the most like interesting part of this presentation will start. Like we first check, in the questions, we ask them some questions to assess how they adhere to PPE decontamination protocols. And we can see here, like it was found 90% of the participants felt fully or mostly familiar with decontamination procedures. And also, only 13% of respondents said always follow the PPE decontamination procedures. The first one, which is in the left-hand side, is a good piece of results, heartwarming, and the second part is so discouraging because 13% is very low. And also we can see the next slide, please. Yeah, we ask some reasons like why the respondent don't follow the decontamination procedures, and 29% of them said it is due to the time constraints, and 3% said this is because of lack of training, 24% stated that this is because of lack of education. Sorry, 20% said it is due to the lack of education, 24% due to the lack of facilities, and 11% said PPE is always cleaned as per the procedure in place, and 13% had some other like reasons for not following the decontamination procedures. Next slide, please. Yeah, and again, we asked them like then in some sorts of questions we asked like the respondees like how effective do they think the current decontamination procedures are, and we can see 52% felt their decontamination procedures are only somewhat effective at removing contaminant, with further 14% claiming that their current procedures are not effective. So this is something to like consider seriously in terms of if we are going to revising the regulations or going to prepare some new materials, this should be considered. The next slide, please. And again, as another part of the questions, like we assessed, like are firefighters confident in decontamination procedures preventing long-term health risks? 55% of the respondents said they are not confident whether the current decontamination procedures are able to prevent long-term health risk. And also the other 29% of them stated they are not sure about it. So if we add these two together, so it means that only 16% of them are sure that the current in place decontamination procedures will prevent long-term health risk for them. The next slide, please. Yeah, then and in continue, we assessed like, okay, then decontamination procedures are not trusted by some people. Some of them say it is not reliable enough to keep long-term hazards, but we are going to change it. Then what are the challenges to implement this change on decontamination methods of PPE? So as a one part of like interviews, our interviewee B like stated that firemen hate two things. They hate things the way they are, and they hate change. So, and if we consider like this, the graph next to it, we can see like the biggest challenge implementing decontamination procedures are listed like as a lack of training, say 30%, lack of knowledge, it is 32%, like budget limitation, 53%, lack of time to create an effective procedure, this is 30%, or poor facilities, it is huge, it is 58%, and resistance to change was 38%, and the other reasons were like for 11%. Next slide, please. Yeah. And also, as a part of the questionnaire, we ask them like how frequently they send their PPE for advanced cleaning. 49% said that only 49% of respondents like sent contaminated PPE for advanced cleaning after each incident. This is huge number. That number gap, like 51% don't do that, and 15% of respondents never sent their PPE for advanced decontamination. Based on whatever discussed in the previous discussions and the experimental results, we know some carcinogens are there, we know some like toxic and harmful materials are there. So even this 15%, which never like sent their PPE for advanced cleaning, or even that 10% which send it only after one or one in two incidents, both like as the both sides of the range, I can say it is horrible, and it can impose loads of problems in that case. And the other results we've got was 66% of the respondents stated that they had to put on or reuse the contaminated gear in some stage and some time. And based on the literature, there's a lot in the literature, but here I just picked one sentence here, which from a research has been carried out in 2023, stating firefighters who stay in their PPE for more than 4 hours after a fire incident were found to be as twice as likely to develop cancer than those who immediately remove PPE. And I'm going to add off-gassing, I'm going to add cross-contamination, and I'm going to add a lot of like the similar type of problems like related to not decontaminating properly or not decontaminating on time can make it to happen. The next slide, please. So again, in some step, we ask them, so please give us the recommendations from your own perspective, what we can do to improve it, what they can do to improve it, and what's your suggestion? So here I tried in this slide to classify them in different parts. So we can see some of them, like it said improve the station cleaning facilities, especially for breathing apparatus, and having dedicated decontamination areas, showers, storage facilities can help them. And as a statement from our first interviewee, we see like a breathing apparatus sets are difficult to clean because there's lots of parts to them. They are not easy to clean because they're funny shapes with lots of corners and hidden crevices, and things are like that. So we can see like that was a barrier for them. The second group of these suggestions are like spare PPE and equipment, like faster return time for laundered gears, and spare gear can be expensive. So many firefighters mentioned they felt reluctant to send PPE for cleaning due to the long cleaning times and lack of spare gear. And the second group of the suggestions and recommendations are related to education and training. And they propose like if there would be stricter enforcement of the contamination procedures, they would follow it. So education on the benefits of PPE decontamination and the detrimental effects of contaminant exposure is the part that we in university can play more to improve the situation. And the last part of the recommendation was related to health monitoring. We heard a lot from the people now as a part of the project we are interviewing, and as well as in this part of the study, that preventative health screening and looking for the most common type of cancers found in firefighters can help a lot because they can give them first a good knowledge about their current conditions of health, give them a good confidence, and then in the next step, it will help them to keep it. The next slide, please. Yeah. And as I mentioned, this is a future, this is a part of ongoing work. The future work is including like to expanding the questionnaire, and this is now open and interviews are in progress. I'm going shortly to share the QR code with you, not on this webinar, but later using the emails. Like I'm going to share it, and we will appreciate it if you could distribute it, and then we can get as much as possible. And integrating the results of this study with other parts of the project is a part of our future works, and comparison of the gain results with other reports and research in the literature and in the other institutions. And something I need to add here is that all respondents and all interviewees, like everything is like anonymous. So we even don't know who responded, who not. So feel free to respond exactly what you think in this thing. If you received the link and would like to help us by answering that questionnaire. And next slide. And thank you very much for your kind attention. And I hope you like this presentation.